Hope for Tomorrow is a registered nonprofit. We host cancer health and wellness retreats and seminars.
I met Avis quite a few years back, and we ended up communicating. She told me that she had this dream and this vision about this cancer retreat, and she asked me if I could help her because she wants to come back home to the island and give this donation back to the ladies, and this walk and this journey back to the ladies that she went through, and it would help her. And I told her I'll do my best to try help her as much as possible. So for the first retreat, I was on board. 6 years later, we're here.
Why do I think this retreat is important, and what are some of the benefits? I think it's important for women and people in general that are survivors to know that there's always hope. There are always new modalities. There are other things that you can do.
The retreat is extremely important because it is a holistic approach to cancer therapy by cancer patients.
There's so much information that we received over these past 5 days. The speakers, the 3 doctors, they were amazing. They were very informative. And the cooking sessions, they were awesome.
The amount of knowledge they shared with us is, you can't put a price on it.
I got to meet some amazing women, and I got to have an opportunity to be inspired.
Showing love and receiving the love that is in this place.
What have I enjoyed the most? Everything. The food, the beach, the environment, the people. Awesome. So I'll be back anytime they need me. I'm going to start with a question. What does wellness, and there's no right answer, okay? What does wellness mean to you? So what I do is, I'm an internist. I'm traditionally trained in internal medicine, but I've been in clinical practice for the past 39 years now. And I really believe in the world of integration, the best of both worlds. Eastern medicine, Western medicine, putting the two together. What I've called for decades, the best of both worlds, is really the way I feel medicine should be, practiced and on people, making sure that they know that there are other options for them. So, what I'd like to talk about this morning are my 5 points of wellness. What are my 5 points of wellness that I work with and I talk to and I teach my patients about? My 5 points of wellness. And what are they? Number 1 is the fuel that you put into your body. I didn't use the word diet. I talk about conscious eating. Number 2, I mentioned movement. I didn't say exercise. I said movement, because movement is extremely important for the immune system. Number 3, some basic nutrients, probiotics, vitamin D, omega-3s, CoQ10. Again, some of the things that are important and critical for women in this stage of life. And number 4, I talked about hormones. For this particular group, hormones becomes a little bit tricky, but for everybody else, hormones become a very important piece of your everyday life. And number 5, I talked about spirituality, doing one good deed a day to boost your immune system.
Albert Einstein said insanity is doing the same thing over and over and expecting a different result. To me, it seems that that's what we've been doing in conventional therapy. That's how I got on this journey. And many of the therapies that we are offering now in Eleuthera, or will be offering soon, actually they're here, are based on a lot of learning courses where I've been to people, or courses where, especially the Europeans, look at cancer very, very different than we do in the West.
For doctors who know only of these harmful effects, the very idea of ozone as a medical treatment.
The presentations, videos that I made were specifically with ozone, intravenous ozone, and the many uses of ozone as detoxification therapy for infections and cancer and autoimmune diseases. The second one, which was extremely interesting, which people did not know a lot of, is the risk of dental infections in chronic degenerative diseases, specifically root canals as a cause of cancer, Parkinson's disease, Alzheimer's, numerous infections, and especially heart disease.
Muscle memory. So often we get into a situation that triggers us and we get that same feeling and we behave in that same way, but the situation in the present isn't the same. And this is where we start recognizing how we need to move into the present and come from the past, which is the future brings us anxiety. The past brings depression, the future brings anxiety. Because it hasn't happened. What if this happens? What if? And so you become stressed and anxiety. The present, the right now, is the only thing you have control of. We often have a very older generation that live in this limited mindset. This is how it is, this is what the rules are, this is how we go. But in reality, we've got new cell phones, we've got digital, we have everything in life has changed. Things have grown, and unless we open it up and we live within a growth mindset, we're not going to live well.
To kind of enhance the experience for the ladies, one of the things that I came up with was knowing your numbers. That was my focus. As a healthcare professional, there are certain numbers. When I say numbers, I'm thinking about numbers like knowing what your blood pressure numbers are, your glucose, your cholesterol, and what we call the body mass index. So I said, okay, what I will do is I will prepare a card with all that information. In addition to that, I added the weight and the height. And so I was able to prepare a card, and I brought the card down. I did all of those checks. I did the blood pressures, I did the glucose, I did the cholesterol test, and I also did the body mass index. And so the ladies, they came in, they had all of those services done, all of those tests done. And I was able to, based on the results of them, I was able to teach them and educate them on certain things that they need to do moving forward.
Why do I think this retreat is important, and what are some of the benefits? I think it's important for women and people in general that are survivors to know that there's always hope. There's always hope. There are always new modalities. There are other things that you can do. Making sure that your vitamin D level is good, you're taking a little bit of selenium, you're doing the exercise, you're doing the grounding, but also following up with your doctor to make sure that everybody's on board for your wellness. And the benefits is just all of that, is making sure your diet's right, making sure that your nutrients are optimal. So the benefits are all of those pieces together to give you a better outcome.
The retreat is extremely important because what it has, what it seems to me, and this is my first one, it is a holistic approach to cancer therapy by cancer patients. What it was good for me, or especially good for me, is to hear the cancer patients speak about their radiation chemotherapy, how it affected their lives, and what they could do to alleviate some of the symptoms.
There's so much information that we received over these past 5 days. The speakers, the 3 doctors, they were amazing. They were very informative. And the cooking sessions, they were awesome. It even gave me ideas as to how I can cook even more nutritious meals. But I just want to say that the speakers spoke to us about so many things. But one of the things that they really spoke to us about, how effective vitamin D is for our bodies. And so, we live in a climate where everybody says, oh, you get a lot of vitamin D, but you getting the vitamin D and the body absorbing the vitamin D is 2 different things. And so while we are out in the sun, we're getting the vitamin D. I think for me, the absorption of the vitamin D was so important. So while I'm getting vitamin D from the sun, the vitamin D needs a carrier, and so in addition to the vitamin D, we also need vitamin K, okay, and vitamin B2. And so those were some of the important keys, along with so much more that I would really like to share. But those were one of the two that really stood out in my mind.
What I enjoy the most about teaching survivors is, I feel, the most important thing, and that is hope. There's always hope. As I have said many times, the hope comes in various forms. Maybe just holding somebody's hand and giving them hope that they're going to be fine. Looking at their blood work and saying, you know what, this isn't that bad. And making sure that we as physicians, we as caregivers are there to help them. That's what, for me, it's all about. I'll never forget what I was told when we graduated from medical school, and that was, the dean of our medical school said, the way you will know that you have been a success as a physician is to make a difference in one person's life. And that's what I want to do, is to make a difference in one person's life throughout my career.
Hope for Tomorrow is a registered nonprofit. We host cancer health and wellness retreats and seminars. This year's retreat was the first time that we had all of our speakers in person, and that allowed the participants to have a first-hand experience with the three doctors that presented and the other speakers. So this year was more personal. It was more informative. The sessions were longer because the presenters were all in person. So instead of it being limited to a 1 hour Zoom meeting, the ladies were able to have sessions of an hour and a half and be fully engaged. It was so much information that was shared. It was so much coping skills. It was so much new techniques, new tests that came out that are able to assist survivors in their journey into wellness.
Yeah, this is a vision that's moving forward from the beginning, to the end. We have a vision, and the vision is to see, the end vision is to see us having a home base where we have doctors, patients could come and stay for lengths of time, that we could really meditate to their mind, body, and soul and spirit to see if they could get their life turned around from this disease that is drastically attacking so much ladies. We see this foundation going to where we have full-time ministry, full-time service. That full-time high-end service is what we're after, where we just really take care of them medication-wise, spiritual-wise, food-wise, and the whole help towards their journey and turning their life around is where our end goal is, trying to do that to each and every lady who passed through our retreats.
What inspired me to start Hope for Tomorrow was when I was battling cancer. I was also battling a bit of divorce, and I needed an outlet to reboot, to restart. I needed a getaway. I was afforded that opportunity by my oncologist recommending that I attend a retreat abroad. It was a weekend retreat, 3 days, and it turned my life around. I attended that retreat. I had an awesome time. I came back, I started to apply what I've learned in the retreat to my life. And then I realized there were a lot of other persons in the same situation I was in that needed that getaway. And there was no place here in the Bahamas for them to go. So after realizing that that was a real need in our community, I decided to form Hope for Tomorrow. My hope is that the information that the ladies receive is all information that further advance them in their wellness journey, to help them, to assist them, to give them the skill sets they need so that they could survive cancer, so that they would not have a reoccurrence, and for them to take that information and apply it to their lives. I was diagnosed in 2022, August of 2022, after an impromptu self-examination that I really wasn't supposed to do, but I ended up putting my left hand on my right breast, and I found what I thought was a large lump.
Well, I was diagnosed back in 2019, and immediately I went to seek help. So, long story short, I found out that I had breast cancer, so I did the whole 9 yards, double mastectomy, breast reconstruction, chemo, radiation, immunotherapy.
First of all, it was very hard. When I got the news, I took it as a death sentence and thought that there was no hope. And then with persons giving me, information that how it can turn out negative, it just added to my despair. But then I was able to find hope through friends and different persons to encourage me to keep going.
So my journey started in 2013. We found a small lump during my annual physical. Fast, we did a scan. It said that it was benign. Fast forward to 2014, it was growing a little bit in size, so we did another scan. They said it was benign again. But my doctor, Dr. Harris, said she was not comfortable with those two results, so we did a biopsy in Cleveland Clinic. In 2 days, they came back and said it was stage 2.
I've been now over 20 years survivor of colon cancer.
My journey started May of 2023. I went through 32 rounds of radiation and 6 rounds of chemo. The journey was not as difficult as I thought it would have been, but through God's grace and His mercy, I was able to get through it with minimal side effects, and I'm thankful for that. Well, my journey with cancer, it was a little rough at one point, because when I first found out I had cancer, well, I came and so I cried, and on that, I just leave it in God's hands.
At 12 years old, I started to have lumps. So I had a lumpectomy at 12, then 25, then when I became 38, all those tumors returned, and I had to have my breast moved. I was diagnosed with stage 3 and 4 breast cancer. I had a double mastectomy. I had hysterectomy, taking chemo and radiation. I wasn't really sick, besides nausea and stuff like that, but through prayers and my family, they were great.
My journey with cancer has been interesting. It has caused me to look at life differently. And how I got through it was my faith in God is what took me through it.
I have been diagnosed since January of this year. I've been a survivor from day one.
The retreat has taught me, first, to live in the moment, not in the past, not looking onward to a present that I do not know not looking onward to a future that I do not know what will happen, but living in the present, letting God be God, being very present in my decision making, and also being very active in my health. What I expect is what I put in. Other than that, I can only rely on what God will take me through, and that's what I'm going to do. But it has taught me to live in the moment and to be very present, not to stress about anything. My experience here was meeting the other ladies. That was the most enjoyable part, because I feel now, and I've always felt this way, but now I know that other people
can validate your story because they've walked that walk. They could also answer some questions that even though you may ask a doctor and doctors, they would answer in a very clinical sense, but there's very practical sense of being with other women who are walking this journey. Even though our diagnosis may be the same, our experiences are different, but a lot of the challenges we have are similar. So we can express to each other what's happening, and I like that. I like the way that we are exposed and the camaraderie that we've had.
I think the thing that I was reminded of was how important it is to manage your stress, because I can be doing everything right as far as exercise, proper nutrition, but if I am stressed out or if I'm too focused on the past or worried about the what ifs in the present, that can have a huge negative impact on me, as well as the hormone disruptors, things that I've been putting on my skin, how important it is to read labels, and just to be cognizant of that. I think I just was really encouraged by, I think, the camaraderie among the ladies and talking to them, the interaction with the doctors, and just all the knowledge that I've gleaned. I think that, I would say that was enjoyable, but beneficial.
The most memorable thing that I learned, well, actually, there are two, there are two, but it ties into one. What I put in my body and what I put on my body, and how it can affect me later on in life or even now. The fellowship and the ladies, they were awesome.
The amount of knowledge they shared with us is, you can't put a price on it. So I am grateful for all of the doctors that came and shared with us, and definitely I take back all of the nutritional advice and the healthy, eating and getting into a healthy rhythm. So it was an awesome experience. I would recommend it to anybody. Most was getting to interact with ladies that already been through what I've been through, and realizing that there is a community and we need to lean on one another.
But I enjoyed all of the sessions that the two doctors had brought on to us, and
the most memorable thing that I have learned is just to be present. The past is the past. The future, there's no need to worry about the future, but just be in the present and just continue to live and do the things that are necessary to keep us healthy. That's exercise, nutrition, and supplementation.
Being on this retreat, I learned a lot about the new healthy food, what we should eat and what we should not eat. And I had a lot of fun meeting people, and we just talk about what we went through with cancer and what they've been through with cancer and their radiation and their treatment. It helps a lot because once you sit down and talk to each other and you know what they went through, so it makes you stronger in being a cancer survivor.
The most memorable thing that I've learned at this retreat is how important taking vitamins is for your body, and how important water is, and also how to eating healthy, taking care of yourself, how important it is to take care of yourself. So I really enjoyed the fellowship, hanging out, sitting there, talking, just all the love and affection, sharing the camaraderie. It was excellent. That was good about it. That's all the fellowship. It's wonderful.
I enjoyed the unity. I enjoyed learning how to make healthy meals, and I've just had a overall good experience being in Current.
My most joyous experience was just being around other females that went through the same thing or that is going through the same thing with you know, like myself, and just getting to know their story, hearing their story, and it motivated me that there's life, you know, that there's hope at the end of the tunnel.
What have I enjoyed the most? Everything. The food, the beach, the environment, the people. Awesome. So I'll be back anytime they need me.
Very, very open-minded. I'm sure it's going to grow. I like the size. It's nice and small, making it easy to communicate right now. But also, the retreat does things other than talk about medicine. It speaks about lifestyle. It speaks about exercise. They have food. They talk about the food is really good, very healthy. It also addresses personal care and taking care of oneself. Take care of the whole person, a holistic approach to health, so that you know, it's not like you just do one thing. So you do other things and bring it all together. So yeah, the holistic approach, I think.
I would just like to say a special thanks to the founders, Eric, Ezra, and Avis, for really starting this retreat. Hope for tomorrow. This is an excellent retreat. I mean, even though the time was only 5 days, there was so much that we gained, so much information that was given in the 5 days.
The most important thing to do is do the things that are necessary for me to stay healthy. And again, I would say exercise, nutrition, supplementation, and most importantly, trusting in God.
Eat well, in proper balance, exercise, manage stress levels, and I think they're the three critical ones. And proper nutrition, proper vitamin supplementation.
Just interacting with all the people and showing love and receiving the love that is in this place. Avis and her team has done a wonderful job, and the best part has been fellowshipping and spending time with persons that are, you know, of like manner.
I intend to make small choices, and I also intend to be more spiritual and to come closer to God, as this has been guiding me to a closer walk with my God.
I'm going to conquer cancer, and that's the mindset that I've had from the onset of my diagnosis.
I am going to conquer cancer, and let me just say that there's life and death in the power of the tongue. I have conquered cancer.
Oh, I had conquered that cancer. There's no going back. I know I've conquered it. So that's what I believe.
By the grace of God, I have conquered cancer. No, I'm going to conquer cancer.
No, I am going to conquer cancer. Cancer will not conquer me.
I believe that I've conquered cancer because of my faith in God, and I believe that I'm already healed.
Well, actually, from I was diagnosed, I know that I've already conquered cancer. So I've already conquered cancer. I'd like to say a big thank you to my donors, my sponsors, who make this event possible, to the presenters that would have informed the ladies and came alongside me, to the vendors, the different vendors, the masseuses, the nail technicians, the photographers, to all of my vendors, to the members of Hope for Tomorrow, to the board of directors, and everyone who supports Hope for Tomorrow. I'd like to say a big thank you, and without you, this is not possible.